All right, this talk follows through my previous talk, and I'm going to talk about how we can reduce deaths in the world by half, mainly in cardiovascular disease. I haven't included any of my data on cancer, but if there are questions, I can deal with this. First, we all have to accept that death in old age is inevitable, but death in middle age and young age is highly prevented. Can I ask our sisters also to give me a chance to get my words across? Thank you. And so we're going to look at deaths before the age of 70. Now, as I get closer and closer to 70 cutoff for old age changes. Okay, so the first thing is we're going to look at deaths under 0 to 4, 5 to 34, and 35 to 69, because the causes and the types of deaths are different, and can we reduce mortality in each grade? Now, in 2010, there were about 50 million deaths in the world, about 8 billion people, 50 billion deaths, and 30 million, about two-thirds, occurred before the age of 70, 7 million occurred before the age of 5 million between 5 and 34, and 18 million between 35 and 69, and my focus today is on this mainly. So one way is to look at the history of countries, and England is a country that has good statistics going back to the 1800s. So let us look at mortality rates in 1910, 1960, and 2010, and at different ages. First, you will see this is the mortality rate in England in 1910. You will see that by the age of 10 years, 20% had already died. By the age of 50 years, 40% had died. And by the age of 90, 100% had died. By 1960, you can see this line has improved enormously. Here, only about 4 or 5% are dying by the age of 5. Here, it's about 10%, and here now, at least 5% are alive. By 2010, this has improved further. Very few deaths under the age of 5. Mortality by the age of 50 is under 10%, and now you will see close to 20% are living beyond 90. This is a huge advance. In the last 100 years, we've seen the greatest advance in human health that ever since man has been on this earth, which is 150 million years. Now, in the UK, as I showed you before, this is the mortality rate in men at the age of 70, and you will see in 1960, 42% had died. By 2010, 20% had died, and among smokers is where the biggest reduction. But even in non-smokers, there is a reduction, but it is only 1/3 of it. But so overall, this is really the impact of healthcare. This is the impact of stopping smoking. And if you look at worldwide childhood mortality, in 1950, approximately 1/4 died by the age of 5. By 70, 14%. By 1990, 9%. And by 2010, 5%. So in the intervening 60 years, we've had a 75% reduction in childhood mortality worldwide, including Africa, including in the poor countries in Asia. And if you look at mortality in the world in 1970 and 2010, you will see by 5, you will see about 15% had died. By 2010, it's only 5%. Here is mortality in the world as a whole. You will see by the age of 50 in the 1970s, about 30% had died. This is down by 50%, down 15%. And by 70 as well, you'll see a very large reduction. So huge reductions worldwide. And in the poor countries, they did not have all the high technology. It was all simple things like tobacco, reduction in poverty, improvement in social conditions. These are the things that had a big effect. Now, I hate to say this, but really social change has at least as big, if not a bigger impact on health as healthcare delivery. Healthcare delivery is important, but social change is important as well. Now, I'm going to show you a series of slides, and this is just to orient you. First, this will be mortality in a given country in 1970, and then the head of the sperm will be 2010, okay? And then this will be the lowest age group, under 5. This is 5 to 40. This is the mean in the country. This is over 40, okay? That will be the format of the rest of the slides. These are the data in the world in 1970 to 2010. Every age group, 0 to 4, 5 to 49, 50 to 69, it declined, and this is the average. It declined in rich countries. It also declined in the poorest countries in the world, and in the upper middle countries and the lower and the high middle income countries and the low middle income countries. By and large, this is a universal phenomenon. So to look at this in more detail, and these are data from my friend and colleague and mentor, Professor Richard Peto, he took the 25 most populous countries in the world, and which includes 75% of the world's population, and in this, Canada and Saudi Arabia are not included, okay, because we are not in the top 25 countries. And we are looking at the mortality rates, as I showed you, between 1970 and 2010 in these 3 age groups. So let us look at this and look at the Democratic Republic of Congo. There's a decrease. Nigeria, there is a decrease. Ethiopia, there is a decrease. And even in rich countries where the mortality rates were low, it decreased further. And if you look at specific countries here, and that is India, with the 2nd largest population in the world, look at that enormous drop in mortality. Look at China. It started lower, but it further dropped. And look at the USA, which is amongst the richest countries in the world. It was low and went down even lower. Or Japan, with the highest longevity in the world, it also went down substantially. Now, if you look at those between 5 and 49, I'm not looking at 0 to 5, because between 5 and 49, the commonest causes of death are tobacco, alcohol, and road traffic accidents. Those are the commonest causes. Now you're going to start to see variabilities, and war. You'll see South Africa, actually there's a decrease and then a marked increase, and this is HIV. And there are other countries like Ethiopia that has come down. Or look at Russia, that was moderate but went up and then came down. And look at Iran, it went up. This is the 1 million people killed in the war with Iraq. So war is a big problem in these countries, and the next one is just showing you the data here for India, huge drop, China, huge drop, and this is France and the UK, again a huge drop. So apart from this, which is Russia, Africa, where HIV played a role, and Iran, which war played a role, by and large, these are seen. Now, what about between 50 and 69? And you will see here, again, most of them show a decrease. And then, except here, this is Russia. It went up dramatically. With the fall of communism, the whole system became chaotic. What is that noise? I wonder what it is. But not a bomb or anything, is it? No. And then okay. Anyway, so you will see that this went up dramatically in Russia, but most of the countries, including India and China, you will see, this is India, this is Ethiopia, one of the biggest countries in Africa, this is China, this is the US, there is a drop. Now, in Russia, the main causes of death during that time was a 4-fold increase in traffic accidents. You have a big problem with that in this country. 6-fold increase in other accidents, 8-fold increase in suicides, and a 10-fold increase in murders in Russia. And the main reason is there are 4 big causes: tobacco, HIV, alcohol, adiposity, and war. And in Russia, it was alcohol that was the main problem. Now, what about in the whole thing 0 to 69? These are the numbers. I showed this to you. So can we reduce this by 50%? in the next few years. If you break it down, out of those 23 million deaths, 5 million deaths are cardiovascular. So if you can reduce cardiovascular deaths by half, that is reducing 2.5 million deaths a year in the world, and a similar number of non-fatal heart attacks in the world. Cancer is growing in many countries, especially the rich countries. It's not yet globally as much as vascular disease, but in 25 years, it'll be the same or even more. And other communicable diseases here, 2 million deaths are communicable, 2 million deaths are injury, and injury, the two commonest causes are road traffic accidents and war. So you avoid war, you'll avoid a lot of deaths, you avoid road traffic accidents, and like in Canada, road traffic accidents are 95% lower than it was 40 years ago after standardizing for the traffic. So the issue is, can we decrease vascular mortality and cancer mortality? But I'm going to focus on vascular mortality. And in the UK, look at what happened. This is around 1917 men. Look at the drop in the 40 years. This is about 25%. This is just over 5% in men. Look at what happened in women. There was a gradual decline way down. This is a point at which people like me got into research, and we did the first ISIS trials. And you will see there is a marked decrease, especially by better prevention and better treatment. This is Hungary. That gives you a different picture. In males, there was an increase over that period. Somewhere here, the communist government fell, and healthcare started to improve, and you will see there's a decrease. The biggest change in Eastern Europe is a decline in tobacco and a decline in alcohol. Those are the two things. And in women, you'll see it was pretty flat because alcohol and tobacco was not a big issue, and then started to go down, and this is the improvement in healthcare. Look at the Russian Federation. It actually went up. This is when Gorbachev brought in a control on tobacco and alcohol, it declined. But then when Yeltsin came into power, everything became chaos and it shot up. And then it came down and then went up. Now it's coming down again, and this is women. Now in Mexico, there is a funny phenomenon. In men, you will see ischemic heart disease went up and still remains high. And this is the increasing epidemic of obesity and diabetes. The mortality rates from diabetes in Mexico is 10 times that in diabetics compared to England. That is poor care of the diabetics. So diabetes will lead to a huge healthcare burden. And the only way to prevent that is to reduce obesity. And this is women again, you will see there is an increase remaining high. But contrast that with cerebrovascular disease. You know, in Mexico, there's a decline. So why is it that heart disease went up, but cerebrovascular disease went down? I don't know the reason. But so we can't assume that both will go in the same direction. Now, as I told you in secondary prevention, for those with disease and still good quality of life, using 4 simple treatments: generic statins, blood pressure lowering drugs, ACE inhibitors and beta blockers, and aspirin, reduce mortality by 75%. And the polypill is going to be a key thing in cardiovascular disease prevention globally. And Saleh was there at the meeting with the WHO, and the WHO strongly endorsed the polypill becoming one of the most important things for secondary prevention, because it will lead to better patient compliance, only 1 pill instead of 4 pills. It leads to better physician compliance, because the physician doesn't have to think of 4 things and write 4 prescriptions. And it leads to better access and lower costs, because you're only distributing 1 drug. You're not distributing 4 drugs. And so the cost associated with advertising and distribution will go down. And if governments take this on, then all those costs will also be reduced lower. And we could probably reduce in high risk primary prevention, a combination of a statin and blood pressure lowering will reduce mortality by 50%. 2 low dose drugs plus statin, very easy. You know, in people with blood pressure that's elevated, it will control it, and it's practicable in high and middle income countries and also in many low income countries. So these are the 4 big modifiable causes: tobacco, blood pressure, blood lipids, and adiposity. And these are data again from the Women's the Million Women study that shows that even light smoking doubles the risk, and obviously 10 cigarettes, threefold risk, 20 cigarettes, sixfold risk for heart disease, and this is cerebrovascular disease. So all forms of tobacco, even at low doses, are bad. And I've shown you this earlier, that a 20 millimeter reduction in systolic blood pressure will halve vascular mortality. 2 blood pressure lowering drugs at low doses, say an ACE inhibitor plus a thiazide, or an amlodipine plus a thiazide, that will lower blood pressure by 10 millimeters, and that will reduce mortality by 25%. And if you want, we can discuss the SPRINT study later. I don't think it is applicable to the average situation. And a good generic statin, again, can be very effective. It can reduce LDL by 2 millimoles. That is, vascular risk is reduced 40%. But let's say we only get 1 millimole, that's still reduced 20%. And overweight, we talked about it, a 10-unit increase in BMI, and in the data Khalid showed us 60% of people in Saudi are obese, another 28% are overweight. So this is an important message for this country. And so, as I told you, in Mexico, more diabetes in the US and much greater mortality, relative risk of 4, and it requires inadequate treatment. And now the thing about cigarettes, again, I'm coming back to this simply because you have no tobacco control policy in Saudi, and you really need to take it seriously. Practically every high-income country and most middle-income countries in the world and many low-income countries have strong tobacco control policies. And so you really need it. So there were 2 big price rises in the UK, one as late as long ago as 1947, 63 years back, another one in 1981, and immediately there was a drop in tobacco. And in South Africa and France, the same thing has happened. If you triple the price of tobacco, you halve its use, but you double the amount of money that the government gets. Okay? And so this is the real cigarette price, triple, smoking halved, and the tax yield to the government is doubled. And so again, annual tobacco deaths, 2 million in the rich countries, 2 million in just China and India, and 5 to 6 million. We talked about it. I showed you this again. I'm showing you again, because 1 billion people will die from tobacco in this century. So we really need to focus on that. And so the 4 major causes are tobacco, HIV, alcohol, adiposity, and war. And I don't have to tell you about the damaging effects of war. This region, if not Saudi Arabia yourself, is not suffering from it, but the Middle East is, and lots of people are dying from it. And so if we can affect these 4 causes, we will easily be able to halve mortality in the world in the next 25 years. Just imagine that. Just, if half the people in this room were to die without these measures, but they were all to live, wouldn't that make a difference? So this is a hard slide to read, but essentially it is saying if the rates of decrease, rates don't change, we don't do anything, obviously the number of deaths will remain the same. But if we get the fall that we saw in the last 30 years, in the next 30 years, we'll get a 33% reduction. But just like I showed you in Russia and in South Africa, you can't assume that the fall will continue. There could be a war, and suddenly your whole infrastructure is changed. There could be a new disease, and that can change everything. The teenagers may go crazy and drive like mad and get drunk and kill half the population. So you cannot assume that the falls in the last 30 years will happen. But if we do something more major, and we try to do what the rich countries did, we can get a 40% decline. And if we really try hard, we can get a 50% decline, which means instead of 44 million deaths in the world, we will only get 22 million deaths. Not 22 deaths, not 44 deaths. It is 22 million deaths. And so I need to acknowledge that this is work a large group of people around the world have done, including Richard Pito, our group in Interheart, Interstroke, and Pure, and all our work in over 50 countries. Thank you very much.